Hi, my name is Brandy Butcher, and I am doing Activity 6 for SimPath, the BSN SimPath program at American Sentinel University. This activity is for my capstone project. It is a timeline, budget, and evaluation. So, I fully developed a realistic timeline in which my capstone can be completed. So realistically, after looking at everything that I would want to implement, I think that 5 years would be realistic as far as coming up with the money and the space and everything needed to implement it. However, things could be implemented with the things that I wanted to do prior to that doesn't cost hardly anything. That's just an overall timeline. The potential budget that I came up with was so I said that we needed to have mental health counselors readily available. So if you hired 3 mental health counselors at $65,000 a year, that would be $195,000 a year. And then I said that these should be made available for free to employees and their family. I discussed to open a bank account and have employees contribute to the bank account for celebrations to try to encourage teamwork and team building. And I think $5,000 a year would be good for that. That is not an expense to the hospital. That's more so to the employees. And then I suggested that we have meetings to discuss things in the shifts and be able to debrief. So that may put people into overtime. So I budgeted $20,000 a year for overtime. So the total for the year would be $220,000. Over a 5-year span, that would be $44,000 a year to come up with the full amount to implement everything. However, while doing my research, I did find that the estimated cost of nursing turnover ranges from $10,000 to $88,000 per vacancy, depending on the position. And the overall cost of turnover ranges from $55 million to $5.5 million to $8.5 million per organization. So if you think about losing the nurses that you could kind of invest in to keep, you're actually going to be saving millions of dollars. So in the long run, the $220,000 that you're going to spend up front initially to get everything implemented is not that much. Also, I read an article that says ED nurses suffering from symptoms of burnout can have detrimental effects on patient safety. When patient safety is compromised, there's a potential of increase for medical errors. When medical errors happen, some of them could be infections while being treated. So if a patient comes down with these infections while being treated in the hospital, they're not going to have to pay for it. The hospital's going to have to pay for it. And these can range anywhere between $749 all the way up to $29,443, depending on what type of infection. If it's just a catheter-associated infection, it would be more on the lower end. If it was a surgical site infection, then it'd be on the higher end. And so the hospital is going to be responsible for covering that bill. They're not going to get reimbursed for all the care that they're getting. So, overall, the $220,000 for my plan is not bad at all. And the evaluation tool that I would implement would be, before I started any implementation, I would send out an anonymous survey. This can be done over email. And I would basically do an employee engagement survey to figure out what the employees would like to see happen, what they're feeling, and get input from them. I think a lot of times hospital administrations always think they know best, but they never actually speak to the people that are working for them, making them money. delivering the customer care. And it's the ones that are affected the most, and yet nobody ever looks to seek their opinion. So I think that you should do a pre-survey for an employee engagement and just get their thoughts and their suggestions and stuff. And then after you get all that and you implement your plan, I think you should do another survey and see if they feel that it's working, if it's helping any. And then I think you should hold like an open forum or a town hall per se. Have different times set up and different days, so that way it's not overly crowded, but have them sign up and they can come in, and it'll be upper management and managers from the departments, and go over the results and discuss just what they are thinking, and be able to have an open dialect and let them be able to ask management and administration questions. So that is my cost analysis for my implementation to help with nurse burnout and compassion fatigue. Thank you so much.